But first, America in shutdown, day 15. Now, today, we lost more than 800 Americans who had tested positive for the coronavirus. That's the largest single-day number since this nightmare began. A stunning 3/4 of our fellow citizens are living under some sort of stay-at-home order issued by state governors. New York Governor Andrew Cuomo, while noting that they're not at the COVID apex yet, did offer some encouraging news.
We're testing more people than any state in the country, and I'm very proud of that. More per capita than China and South Korea. Number of intubations was down, not much, but it was down, and that's a good sign. You also see the number of discharges going up, and that's consistent.
Now, the numbers in Washington State and even California are also offering some hope.
A slide that gives us great hope and understanding about what is possible. On the bottom of the slide, where you can barely see that blue line at the very bottom, that's the current cases in California, the cumulative cases in California, where they're doing significant testing. The next line up is Connecticut. The orange line is New Jersey. The blue line is New York. The yellow line is Washington.
Well, that's encouraging graphs in the states where you see those improvements. But tomorrow is only April 1st, and many of you want more answers. Now, given the massive disruptions to life, the huge financial toll, the loss of our basic liberties, Americans dying, more are asking why the models for tracking the disease in some cases have been so far off. Now, the folks at 538 have a theory. There's also the issue, they write, of uncollected or inaccurate data. To determine the fatality rate, you have to divide the number of people who have died from the disease by the number of people infected with the disease. In this case, we really don't have a reliable count for the number of people infected, so to put it mathematically, we don't know the denominator. Now, we already know that some of the early data from the Imperial College, which the US and the UK was using to model its early numbers, was off by many factors. But of course, most Americans, they don't have the time to dig into the underlying data, so of course they rely in good faith on the experts. Dr. Anthony Fauci talked a lot today about their various models, the models they rely on to inform the mitigation strategies.
That's what the model tells you it's going to do. What we do is that every time we get more data, you feed it back in and relook at the model. Is the model really telling you what's actually going on? Models are as good as the assumptions you put into them. Even though it says, according to the model, which is a good model that we're dealing with, this is full mitigation. As we get more data, as the weeks go by, that could be modified.
That could be modified one way or another. And indeed, the mortality rate projections already have been modified. Now, the death rate from COVID-19 is likely around 0.66%, if counting the mild or asymptomatic cases, according to a new study. Now, past estimates had placed the mortality rate somewhere between 2% and an unbelievable 3.4%, which would be devastating. Then another study in the journal Nature Medicine brought it down by almost half to around 1.4% mortality. But in this new study, researchers dug deep into the data to determine the true infection fatality ratio, that is, the mortality rate that includes the people with mild cases, and sometimes not symptomatic at all, who may have not been counted before. It's really interesting. Now, the death rate varied greatly by age. 0 to 9-year-olds, 0.0016%. But age 80 and above, it was 7.8%, and other age groups are in there as well. A renowned mathematician quoted in the study noted that the infection fatality ratio is a very important piece of data that will help to guide the response from various government and public health authorities worldwide. Again, what we're saying on the Ingraham angle is the data matters. It matters to all of us. Real facts, real science. We shouldn't be referring to old data that has already been disproven, because that only ends up scaring people and then confusing a lot of people who actually deserve transparency and a full accounting. Now also, my message to Pelosi and company with her little nasty asides over the weekend, that got a huge reaction last night. So it bears repeating tonight. We all hear a lot about a whole of government approach. Almost every day we hear whole of government. So I have a question. Why is Congress out of session? Do you know that Congress stayed in session during the Spanish flu and also during World War II? After all, we're told that this battle against COVID is a war, and the government's response to it has resulted in millions and millions of Americans losing their jobs and their dreams in an attempt to try to bring down that curve. Tens of thousands of Americans could die tragically still from COVID. We all want to save more lives. We want to do everything we can. But we also at the same time, and it's a heavy lift, it's a lot of balancing here, we have to give Americans a realistic sense of achievable metrics to measure success in the end. So all the graphs, they're informative and they're nice to see, but we have to know that parents are asking tonight, what numbers will it take so their kids can go back to school at some point? Maybe next month, the month after, maybe in the fall. What numbers will it take? And what numbers will it take for Americans to return to church? It's really important for a lot of Americans to be able to go to church every week. What about travel? What numbers will it take for us to be able to travel even to another state to see a relative? What about going back to work? That's assuming the job that someone had last month will even be there next month, the month after, or sometime in June. Asking these questions, safeguarding our health and welfare and our liberties, is what all three branches of government, this is what our founders understood, the brilliance of our founders. They understood that you needed all three branches working together, and they should be right now. Checks and balances, of course. We all love and value the doctors and all the healthcare professionals that are just heroes tonight. But we also love our freedom and our ability to support our families. So how likely is it that on April 25th, we might hear that, oh, we really need to shut down through the early part of June in order to bend the curve even more? We better get ready for that message earlier, not later. We should discuss those metrics now, not in 3 weeks.
The mitigation steps that are on your 30-day plan, is that enough or is more needed? Have you been discussing that?
Well, we're going to find out. We
scenes?
hope it's enough. We hope it's enough. We hope we're at a level where we can say, let's go, because our country wants to get back to work. I could ask the doctors to answer that question.
Again, back to the level, to the numbers. Now, speaking of doctors, this is what Sanjay Gupta said today.
What we've been seeing in terms of the way that this information, these recommendations have been sort of rolled out, is that they're coming out somewhat piecemeal, right? First it was a couple of weeks, and now it's been extended another month. I had a chance to speak to Dr. Fauci today, interviewed him for our podcast, and I sort of asked him that question. I said, is this part of the strategy to slowly, ease the country into these existing and deepening or at least lengthening guidelines? And he sort of said, well, yeah, look, we don't want to shock people with this. We want to look at the data. But the data certainly is suggesting that, well, if this was likely to go on beyond April 30th.
Okay, did you hear that? Beyond April 30th. You've heard of mission creep? We may be looking at shutdown creep. Shutting down the country until midsummer, that's what we're all hearing here, would invariably prevent a lot of COVID-19 deaths. That would be a great thing. So would shutting down for the entire year. But Americans, like the doctors, they need to know what objective success looks like and whether it's even achievable within any reasonable time frame, and at what cost to our family's future and to your basic civil liberties. That said, despite the media's best efforts today, the president knows that there are promising therapies already being used right now.
Hydroxychloroquine, is there any early data on these trials?
Nothing that I've heard. I mean, that's the first question I make every morning. The good news is we haven't heard anything bad. In other words, there have been no catastrophic events. I want to give people hope, too. I'm a cheerleader for the country, so it's easy to be negative. And then everybody can be negative, but I'm a cheerleader for our country, and I want them to do a great job. So the number can be kept, and I've always said it, I want as few
a number of people to die as possible. And that's all we're working on.
And he also said America wants to get back, meaning get back to work. Trump is doing exactly what he should be doing. He's consulting with the scientists, listening to all the stakeholders, including the American citizens. And he's confidently reminding us that no matter what the challenge, you bet America is up for it. And those are my thoughts at the end of the shutdown, day 15.